Initially, there was a lot of resistance to get Faye's Light set up in a clinical setting. It took 2.5 years for us to get this approved at our first hospital because they were afraid of us touching people. Once that hospital started, though, and they received all the positive press and the support from the community, within 7 months we started at our second hospital, and after that, now we have hospitals calling us, wanting us to bring our programs to them.
Doctors were a little bit threatened sometimes about what these were and how they worked, but when their patients reported back to them all the different programs they were involved in, they really started to come around, the doctors did. And actually what has happened since we began the program was that finally doctors, as well as social work was always new, but it wasn't just the treatment of chemo, radiation, but rather the psychological aspects that encompassing the whole person, that their personalities and their thought processes were certainly just as involved as their physical body. And so now it's become very, when people are being accredited, they're actually being looked at as providing these services. So it's come a long way.
It's different than any other cancer support center. A lot of people aren't aware, they don't know that they have different options other than chemo and radiation, and this gives them more options. It just lets them know that there's something else out there above and beyond Western medicine. It's just an addition, an alternative to, a complement to the treatment plan that they're already going through.
This was a totally new concept for Ingalls, for the inpatient unit, to have an outside people to come and offer these kind of treatments, free of cost to the families, to the patient. We see people that sometimes nobody even comes to visit, and a Faye's Light employee comes in and offers a massage or Reiki, and that person really feels like somebody cares about them. When we first started, complementary treatments were not as popular as they are now. We had to talk to the physicians and let them know what was going to be happening, but once the physicians got feedback from their patients, they realized what a great service this was, something they would never think of offering, and you don't have to pay for it. Patients, once they've had the service, they're asking for it again. We're looking at pain control all the time, and we're looking at things other than medication. We're looking at positioning, comfort measures we can offer that are non-medication. And CMS, which is Medicare, mandates that we control our patients' pain. The hospitals are actually reimbursed on the patient satisfaction scores in that area. Something like Faye's Light is definitely an addition that hospitals or clinics could use to help their patients control their pain.
People just absolutely loved it, and they would almost be transformed when they came out of the sessions. And I had a couple of men who actually called me because their wives were so overwhelmed with their diagnosis that they couldn't even bring themselves to move, to do anything, and the husbands didn't know what to do. So they made the appointments for them, they brought them, and there was such a transformation when the women came out of the sessions, or they just were glowing.
You know, back when I was doing therapy, one of the key terms that we used was universality, and that's a key of belonging. You know, everybody's in it for the same thing, a universal feeling. And that's what you get here at Faye's Light. People that come in here with any type of cancer, it doesn't matter what the type of cancer is, they know that they're coming into a facility, number one, where it's unconditional love. Number two, there are other people who are going through similar things as they are. So they understand the pain. They understand the silence. They understand phrases like chemo fog, you know. You can't get that anyplace else. You have to be amongst your peers. And in this particular case, it's folks who do have some type of cancer. As sad as that might be, you know, the benefit of that also is helping other people. So you can be as sick as a dog, you come in here, you're helping somebody else. And it's just a chain all the way down the line. So it's a